In this video, we're going to learn how to do the barbell back squat. The barbell back squat is an excellent exercise. It's a closed chain function exercise, and there are many variations. People can use the barbell back squat as well as other squatting variations for the strength and conditioning of an athlete, general health purposes, or for rehab. The muscles used in the squat will be your quadriceps, hamstrings, and gluteus maximus. This is a sagittal plane movement. There are other muscles that will help out and assist in the squat, but the primary reason for doing the squat is quadriceps, gluteus maximus, and hamstrings. It should be noted that the squat relies heavily on the quadriceps group. For certain athletes or certain individuals who are looking more for hamstring development, they should not rely solely on the squat and include other exercises that will target the hamstring, or just do different exercises to the deadlift, which also focuses more on the hamstrings. But the squat is still an excellent exercise and can be used by most athletes. When first performing the squat, it's very important you get the proper stance width. Depending on the stance width will determine muscular recruitment. At the very least, we recommend having a stance width of slightly shoulder width apart. Having a narrow stance width will create what's called a forward lean. When this happens, you place a lot of stress on the lower back muscles, the vertebral column, the spinal cord. So your stance width needs to be at least shoulder width apart or wider. You need to have the weight on your heels. The way you can tell whether or not an athlete or yourself has enough weight on the heels is whether or not they can wiggle their toes. If you cannot wiggle your toes, you have too much weight on the ball of your foot. Having too much weight on the ball of the foot increases the shear force on the knee. Your body is very good at taking compressive and tensile forces. It's not good at handling shear forces. So we want to minimize the amount of shear forces in training. So we want shoulder width apart for our stance width or wider, weight on our heels, not on the balls of our feet. When we initiate the movement, we don't want to initiate the movement by bending at the knee. When you initiate the movement by bending at the knee, all the weight will go to the ball of the foot, your knees go over your ankle, and that places a tremendous amount of shear force on the knee. We want to avoid that. We want to start the movement by pushing the hips back or hinging at the hips. By doing this, it decreases the shear force on the knee. It also increases the muscular recruitment of the gluteus maximus and the hamstrings. So we're increasing the recruitment of our posterior chain, which is excellent. Also when doing the squat, we want to have what's called knee valgus. Knee valgus is the caving in of the knees. When this happens, it places a lot of stress on the ACL. We definitely want to avoid that. If you see an athlete going to knee valgus squat, that probably tells you their gluteus maximus is weak. What's happening is their adductor magnus is trying to compensate and help out on hip extension for the weak gluteus maximus. And when this adductor magnus muscle recruits, it also causes the knees to cave in. We don't want to have that happen. Females are more prone due to their Q angle. Make sure that the athlete has their knees over their ankle. The depth you go in your squat will depend on your reasons for squatting. If it's for general health purposes, you may not want to go as low as an athlete. An athlete may want to go parallel. We don't recommend going below parallel in the squat because that places a tremendous amount of force on the collateral ligaments. We want to avoid that force. Also when squatting, you have what's called a neutral spine. You don't have excessive arching of the back, bowing of the back, twisting the spine, because we're externally loading the spine. We'll make sure we have a good neutral spine. That's when the spine can absorb most of the forces when squatting. You also want to brace your abdomen while squatting, or doing any type of exercise that's going to load the spine directly, such as a squat, or even indirectly, such as a deadlift. The purpose of bracing, or basically flexing your midsection, flexing your abs, is it acts as acts like a weight belt, and it increases the intra-abdominal pressure, which also helps reduces the load on the lower back and vertebrae. You have two positions when squatting due to the barbell back squat. You have the high bar position, where it's higher up on the shoulders, and the low bar position, where it's lower on the trapezius. The benefit of doing the low bar position is that when you do the low bar position, it gives you a biomechanical advantage. It's much easier to have good technique, and typically you can do more weight than the high bar position. But when you do the low bar position, it places a lot of stress on the carpals or the wrist bones. So that decision can be up to you. So get underneath the bar, I'm going to do the high bar position for the day. My feet are slightly wide and shoulder apart. My toes are straight forward or slightly turned out. I have the weight on my heel. I make sure not to have make sure my spine is in a neutral position. So I retract my scapula. I brace my abdomen. With my weight on my heels, I'm going to push my hips back, making sure not to cave in my knees. Go down to my desired depth and come up. Weight in the heels, pushing the hips back, engaging that posterior chain, coming up, having a good neutral spine. For more information on anything related to human or sport performance, please feel free to browse our website, the Journal of Sport and Human Performance. Thank you for your time.